What are the long-term effects of COVID-19? Some patients experience lasting health woes after recovering from the disease. Long-term effects of COVID-19. There is a common misconception that people who come down with COVID-19 experience one of two disease courses. They have minimal or no symptoms that clear up in a week, or they get extremely ill and either die or recover after receiving intensive care treatment. But now that the coronavirus has been under sharp focus for more than 6 months, physicians are noting that this binary belief is inaccurate. Some patients in both categories experience lingering symptoms and are at risk for long-term damage to organ systems weeks and months later. Some of these ongoing symptoms can be very serious. The organ damage can occur in the following parts of the body: heart. Heart scans taken months after COVID-19 recovery have shown lasting damage to the heart muscle, even in patients who had mild coronavirus symptoms. Two diagnosed with COVID-19 showed evidence of heart damage caused by the disease weeks after they recovered. Lungs. Pneumonia, which often develops from COVID-19, can leave scar tissue on the air sacs, alveoli, in the lungs, which can cause long-term breathing problems. Brain. COVID-19 can cause strokes, seizures and Guillain-Barré syndrome, even among young patients. It may also add to the risk of developing Parkinson's disease and Alzheimer's disease. Circulatory system. COVID-19 appears to raise the risk for blood clots. Larger clots can cause heart attacks and strokes. But very small clots in the capillaries of the heart muscle are believed to cause most of the lasting cases of heart damage. Weakened blood vessels may also lead to long-term liver, kidney and leg problems. There is a misunderstanding that if I am young, healthy and make it out of the ICU, I will be fine. But recovery is not just surviving the ICU. Survival should be defined as returning to actions you enjoy and are important to you. You can work fully, interact with family and not be impacted by other problems. The idea that COVID-19 survival always results in full recovery is a misconception. We know people who survive a critical illness may not return to normal health. Some can't even drive again. Post-intensive care syndrome, along with the damage done by the virus itself, many patients who spend time in an ICU, for any reason, suffer a condition called post-intensive care syndrome, or PICS. Symptoms include new or worsening impairments in physical, cognitive or mental health after a critical care stay that persist after hospital discharge. It's pretty common. Millions of people are admitted to ICUs each year, and about 70 to 90% who survive can have PICS, post-intensive care syndrome. Physical problems, the most common, affect about 70% of PICS patients and include muscle weakness, walking and balance problems, pain, decreased lung function and difficulty with daily activities like bathing, dressing and doing laundry. Cognitive issues include loss of memory and organizational skills, and affect about half of those with PICS. Mental illness, including anxiety, depression and PTSD, can occur in 20 to 30% of patients. PICS also impacts one's ability to return to work. At 3 months, post-ICU stay, 67% are not back to work. At 1 year, 40% are still not back. At 5 years, 33%. That's a huge problem. COVID-19 is bringing more attention to PICS, which has been known about for a long time. It's hard to get accurate numbers on COVID now, but I think it's a substantial problem. Patients are in the ICU and they are in there for longer period of time. The good news is that rehab can help many PICS patients. The bad news is that rehab is not always a cure. Over time, we know from the literature, people continue to have problems. Rehab helps, but generally people still have problems months to years out. This is a more long-standing problem. Long hauler syndrome and the coronavirus. Another issue afflicting COVID-19 patients has come to be known as long hauler syndrome. Even those with mild cases continued to have persistent symptoms an average of 16 days after testing positive. That compares to only 10% for the flu. These symptoms include exhaustion, brain fog, insomnia, muscle pain, headache, heart palpitations and neurological problems, and can last for weeks or months. They are often diagnosed as fibromyalgia, chronic fatigue syndrome or myalgic encephalomyelitis, and have followed many viral infections, including H1N1, MERS and SARS. Though statistics are unknown at this time, COVID-19 seems especially good at causing them. Basically, post-viral fatigue represents a human energy crisis, where the virus causes a circuit breaker in the brain called the hypothalamus to malfunction. It's like when you plug in too many space heaters and you trip a circuit breaker. This pushes people over the cliff. The hypothalamus controls sleep and hormonal function, and when it trips, it results in a combination of insomnia despite exhaustion, along with chronic pain, he says. From there, it can then trigger an almost dizzying array of other symptoms. From fatigue to fantastic. And the lead author of 4 studies on effective treatment for CFS and fibromyalgia, has been studying the syndrome since a nasty viral infection knocked me out of medical school and left me homeless in 1975. After recovering, I focused on post-viral fatigue and developed a protocol of treatments which call SHINE, for sleep, hormones, immunity, infections, nutrition and exercise. The key thing is helping the immune system, by providing it with zinc and vitamins D, K and C. Improving sleep patterns is also critical for immune function. People with CFS and fibromyalgia improve, with an average 91% increase in quality of life assessments. This is very, very, very treatable. Don't be discouraged if your doctor is not familiar with it. If you are still experiencing any of these symptoms 6 weeks after recovering from COVID-19 or another viral infection. As the pandemic drags on, keep these simple but strategic items at the ready. At-home supplies for COVID-19. Continued coronavirus preparedness. By now, you've already stocked and restocked your medicine cabinet and mask supplies. But we're not out of the woods just yet. The COVID-19 pandemic is expected to last about 18 to 24 months altogether, according to estimates based on past flu pandemics. So, you'll likely need refills and possibly a few new items to help get you safely through, whether by avoiding coronavirus infection or even recovering from a milder case at home. Medical experts offer these tips on health devices and supplies to protect you and your family, and discuss a few items you might not really need. 1. Pulse oximeter. A pulse oximeter is a small, painless device that measures oxygen levels in your blood. You simply slide the pulse ox over a fingertip or clip it onto your earlobe, where it shines infrared light through your skin to give an instant digital result. Normal readings range from about 95% to 100%. There's no gold standard or guideline as to whether healthy people need to own the device. Prior to the pandemic, people who were usually instructed to have a pulse oximeter had underlying lung disease. However, COVID-19 can cause so-called happy hypoxia, in which otherwise asymptomatic people have low blood oxygen levels without realizing it, at first. Oxygen saturation levels also indicate how someone with diagnosed COVID-19 is progressing. If you should get ill with COVID-19, you can oftentimes, if you have mild disease, be monitored at home. One of the main reasons we bring patients into the hospital is if they have low oxygen levels. 2. Thermometer. Fever is a common COVID-19 symptom. As we need to monitor ourselves going into the fall and approaching the flu season, everyone needs to have a working thermometer at home. It's shocking how many people don't have one, and then when they need it, to find that there wasn't one available. The type of thermometer you have matters less than whether you actually have one in working order. Varieties include touchless or temporal scanners that measure the temperature of the temporal artery on your forehead, digital oral, ear and rectal thermometers, and tried and true mercury thermometers. Although readings may vary slightly across versions, each comes with instructions. There are different parameters for different types of thermometers. The temporal scanner thermometers, the ones in the ear, the ones below the tongue. As long as we have a working thermometer in the house, that's going to be a step in the right direction. 3. Thermometer covers. A single thermometer shared by an entire household could pose an infection risk unless you take basic precautions. Temporal scanners and digital probes come with disposable covers or sleeves to prevent spreading germs from person to person. Make sure you have an adequate supply of covers to ensure good hygiene when taking temperatures. Members of households with traditional oral mercury thermometers need to do thorough alcohol wipe downs. There are also sleeves that can be placed on an oral thermometer, and the thermometer can be sanitized with an alcohol wipe between uses. 4. Alcohol wipes, the type nurses use to disinfect your skin before giving an injection, have several household uses during the pandemic. Wiping down medical devices, like thermometers, is easy. Just make sure to let surfaces dry before reusing or touching. Consider using alcohol-based wipes or sprays containing at least 70% alcohol to disinfect touchscreens, keyboards and other components of cell phones, tablets and remote controls. 5. Tape measure. Are visitors really at least 6 feet apart? If people who aren't your usual contacts come into your household, simple items like a tape measure could help you arrange indoor spaces to promote adequate physical distancing. Physical distancing, also known as social distancing, is key for preventing the spread of the novel coronavirus. If you open your home to limited visits from family members or friends, you can take action to help keep everyone safe. 6. Extra seating. Additional seating can make physical distancing easier. For distancing purposes, it's preferable for visitors to be seated than standing. When people gather, if they're not seated, you see them tend to be drawn together inside and outside. And the physical distance is hard to maintain, just because of our social nature. Keep a few extra folding chairs in your basement or storage area, and break them out when company calls. 7. Fever reduces. Having fever reduces such as ibuprofen and acetaminophen on hand can keep you more comfortable if you're recovering from relatively mild COVID-19 at home. It's easier and more practical to stock up on over-the-counter medications before you're coping with a quarantine or self-isolation situation. Although you may be well and fever-free now, that can change. Fever is not necessarily the first sign of COVID-19 infection. A fair number of patients have other symptoms indicating that something's wrong before the fever happens. 8. Prescription drugs and medical supplies. If you can stock up on 1 or 2 extra months of prescription medications, try to do so. Some people with chronic health conditions have contended with medication shortages, particularly during pandemic surges. Patients with lupus who rely on the drug hydroxychloroquine to manage the condition struggled to get their prescriptions refilled when the drug was being touted as a potential COVID-19 remedy earlier in the year. Patients with asthma experienced shortages of albuterol inhalers as hospitals increased their use for patients with COVID-19. If you have a condition like diabetes, you need to keep an adequate amount of medical supplies, like finger stick lancets to monitor blood sugar, at all times, and even more so during the pandemic. 9. Disinfectant. You can still rely on liquid disinfectants or disinfectant wipes to keep household surfaces germ-free as possible. However, wipes have become harder to find with schools preparing to open. If you can't get disinfectant wipes, other common disinfectants are effective. You just have to look at the label. When choosing a disinfecting product, check the label for the following information: types of viruses and bacteria it kills, contact time or wet time, how long it needs to stay wet on a surface to be effective, an EPA registration number that matches the list of EPA-approved disinfectants. When cleaning and disinfecting, use disposable gloves and discard them after cleaning, or dedicate a pair of reusable gloves for disinfecting against COVID-19. Always wash your hands after removing gloves. 10. Gloves. Although gloves play a role in pandemic protection, particularly for healthcare workers, they may do more harm than good if not used and disposed of correctly. If you are cleaning high-touch surfaces and you're using gloves during cleaning, or if you're helping a family member who may be elderly, you can certainly wear gloves in the home. But gloves are meant to be single-use and removed. They're not meant to be worn in grocery stores or other places. Continually worn, contaminated gloves can potentially spread germs and carry disease from one person to another. Instead, You're far better off by practicing frequent hand washing to keep your hands clean. 11. Hand sanitizer and soap. Although it's a challenge to find some long familiar hand sanitizer brands, alternatives are cropping up everywhere, including floral scented and even glitter infused products. Whether you find branded hand sanitizer at the auto parts store or generic brands at the dollar store, the ingredients listed on the label are what really matter. The main ingredient should be either ethyl or alcohol or isopropyl alcohol. You don't want anything that is methyl alcohol containing, because that be absorbed through your skin and be more toxic. And you're looking for 60% to 70% alcohol as a minimum content. While it's definitely handy to tuck a bottle of hand sanitizer in your purse, car or backpack, be sure to stay well stocked with soap as an at-home mainstay. 12. Masks. If your mask collection is wearing thin, now is the time to replenish. Options keep increasing, including clear masks to enhance communication with those who have hearing impairments. Masks contain your respiratory secretions. They have to cover the mucous membranes of your nose and mouth. A mask protects you should someone cough. If you have the coronavirus but don't know it, masks contain your respiratory secretions within and protect those around you. However, your eyes are also mucous membranes that remain open and potentially vulnerable. You can take steps to protect your eyes from the coronavirus. Keep a handy mask cache near your door to grab one on the way out to run errands. Also, make sure that you've got masks available when people come over, so if they forget masks they can still mask within your house. 13. What you don't need. UV light. Some hospitals use UV light devices to sanitize patients' room after discharge and disinfect other contaminated surfaces. However, you don't need to invest in an at-home UV light device in an effort to kill the novel coronavirus. I hope this helps you to come up with the ideas as we struggled every no-choice life must go on. For how long? We'll never know, we just have to fight every day. If you have any comments and suggestion, or anything at all that can help, feel free to write in the comments below. Like, share and subscribe to my channel. Thanks for watching. See you on my next video. Ma salama.